Hello everyone, my name is Hunter. Over the past week or so, Josh and Deborah and I have been working to make a bunch of mnemonics for antineoplastic drugs that we have to know for our MS1 Term 3 Pharma final. The goal with these is to have some kind of recognizable mnemonic for each drug that can either be a sentence or a concept to hopefully help recall any relevant info for the drugs. We try to wrap together concepts of the drug name / mechanism, which will be written out in green, what the drug actually treats, which will be written out in blue, and any drug side effects, which will be written out in red. Some of these partially come from first aids. Also, this isn't 100% comprehensive, but it'll hopefully cover a lot of easy ground for y'all to help remember at least some of the things about each drug. Also, I broke down this video into chunks on teaching the drugs, and timestamps will be in the description. And as a final disclaimer, some of these will have varying degrees of wholesomeness or raunchiness, whatever we were able to come up with at the time. So yeah, let's get this started. Now, first off is cyclophosphamide. To set the stage for the mnemonic we're going to be using, we're going to talk about the actual structure of the word cyclophosphamide, in particular, cyclophospho, as in a cyclo-P, as in a P cycle. On that note, let's get on to the actual mnemonic sentence, which is, Bolo the acrobat has a problem below the belt, in parentheses, pretty mezzed up. So right off the bat, what is Bolo? Well, Bolo is kind of like a clown-ish kind of name, but also a name for like an acrobat, like in a circus. Bolo here stands for the 4 treatments of cyclophosphamide. So it treats breast cancer, ovarian cancer, lymphoma, and oat cell lung cancer. Next, in terms of it being an acrobat, the acro in acrobat stands for acrolein, as in acrolein toxicity is going to build up throughout the body system, and particularly in the urinary tract, and that's going to cause a lot of problems for the patient, as in a lot of problems below the belt, the whole hemorrhagic cystitis or peeing blood. Additionally, with this being a urinary issue, as in a pee cycle kind of issue, by increasing their urinary output and drinking lots of fluids, the patient is able to reduce these side effects. But additionally, in parentheses, the pretty mezzed up is in relation to Mesna being used to treat issues with acrolein toxicity. So Bolo the acrobat has a problem below the belt. So Bolo for the types of things that it treats, acrobat for acrolein, below the belt as in you're peeing blood, and pretty mezzed up as in you're using Mesna to treat. Awesome. So next on to Cisplatin. Here's the mnemonic. Ah gee, Plato, you're touching your balls. Yeah, this can be Plato the philosopher. For all we know, it's someone named Plato. Plato is, of course, for platinum, cisplatinum. The G stands for guanine. It is a DNA cross-linking agent, and particularly it binds to guanine. The touching is also with regards to cross-linking DNA. It is in very close contact. It's touching the DNA. Next, onto the actual things that it treats. Balls. Cisplatin is used to treat testicular cancer. And lastly, these urs that are here in the phrase, ur as in urinary, as in side effect of renal issues. Next, we're on to Etoposide. Now, Etoposide is boring because it's exactly the same thing that Dr. Reddy said. So, topo acts to inhibit topoisomerase in cancer cells, but additionally, the 2-po here, a Etoposide, means that it actually interacts with topoisomerase 2. So yeah, just a little bit more mileage out of the word Etoposide. And lastly here for the DNA-related drugs is going to be Bleomycin with the mnemonic Leo cut the crap. Leo here is for Bleo, as in bleomycin. Cut, as in cuts DNA, as its mechanism of action in cancer cells. And lastly, cut the crap as a whole in all caps. The person is yelling very loud here. The point of it being in all caps is that bleomycin has a side effect of respiratory problems, fibrosis, stuff like that. So yeah, here's the summary of all of the mnemonics associated with the DNA-related antineoplastics. All right, next we're on to the sex hormone-related drugs. First, we're going to start with Finasteride. Now, there is a couple of things we came up with for this that might be useful. So first off, when you actually write out Finasteride, you can actually put a 5 and then an A here for 5A steride with regards to the spelling of it. And what this means is the 5-alpha reductase enzyme that is being inhibited. Additionally, with some of the other mnemonics, we associated the Fina and Finasteride with Fina as in going to, kind of like the slang expression. So you're finna shrink your prostate and finna stop having sex. Fina, Finasteride, you're going to shrink your prostate, you're gonna stop having sex. Hopefully these are a little helpful. Shrinking your prostate, of course, is related to the fact that this can treat benign prostate hypertrophy and prostate cancer. And finna stop having sex, of course, is related to the side effect of impotence. Next, we are on to Leuprolide. Now, there's two things with regards to Leuprolide. First is the first aid mnemonic, where they say using Leuprolide in lieu of GnRH, because this is a GnRH agonist. And normally, with normal fluctuations of GnRH, we're going to be having increased FSH and LH, and that's with the actual fluctuations that are normal over time, in like normal hormone regulation. But when it's actually given to fight cancer, it is given as a bolus, as in there is a sudden increase and then decrease, as in it is relatively constant compared to the rapid fluctuations. And when something is relatively constant, you can say that, it's basically a line, as in if you're giving someone Leuprolide, you're giving a losing prostate line by having the approximately constant amount of Leuprolide in their system. You are not giving them the fluctuating levels of GnRH that they're supposed to be having, so this actually leads to a disruption of FSH and LH regulation, which means you are going to be losing your prostate, as in you're going to be losing prostate cancer. So that's how I like to think about it. Next, on to Tamoxifen, is the sentence Tammy's ox is an estrus. Tammy's ox as in tamoxifen, and estrus as in her ox is in heat, but estrus also as in estrogen, because this is a estrogen receptor blocker. Just a short and sweet one-liner there. Next off is Anastrazole. And the sentence for this one is that after a rest, Anna strolls through the garden to smell the aromas. Anna strolls for Anastrazole, goes through the garden to smell the aromas. It is an aromatase inhibitor. And additionally, rest here is going to be breast. So one of the things it treats is breast cancer. So yeah, after a rest, Anna strolls through the garden to smell the aromas. And lastly is Mifeprestone, with the phrase, turn off that prog rock. If any of y'all don't know what prog rock is, it's like progressive rock, as in Pink Floyd, Rush, bands like that. But let's say you got someone who's nonstop just playing prog rock, and you want them to turn that off. So how does this relate to Mifeprestone? Well, rock here is equal to stone, as in this is the only drug that we have to know for this term, which has the word stone in it. So rock, stone. Next is prog. So prog is, of course, for progesterone. And turn off, as in it is shutting off things that progesterone would be used to facilitate. So it is shutting off pregnancy, for one. And additionally, if we think about what progesterone actually means, like etymologically, progestation, gestation as in pregnancy, what are the things related to pregnancy? Ovaries being in good health, so it's going to shut off ovarian cancers. It's also going to help fight breast cancers, another organ associated with gestation. So yeah, that is all of the drugs that are related to sex hormones. All right, now we are on to the monoclonal antibodies. As a heads up, these mostly just easy associations between the actual drug name and what it binds to. The slides were a little thin with regards to the treatments or the side effects. Let's start with Bevacizumab. So there's kind of two things that came to mind with this. One is the association with UT's mascot, Bevo, the cow, and the other is related to the phrase BVAC, as in bevascularizing. So first off is they bevascularizing. This is going to be the drug that helps combat vascularization, as in angiogenesis of cancers, as in it's going to bind VEGF, which is going to inhibit angiogenesis, because tumors need blood. Additionally, with Bevo the cow, what do cows like to do? They like to moo, as in they like to move around. So once more, moving around as in metastasizing tumors, as in you need angiogenesis, and therefore you need VEGF. So that is what Bevacizumab attacks. So, Trastuzumab. There's a lot going on with this one, a lot of really small mnemonics that we came up with. First off, let's just say the one that First Aid came up with, Trastuzumab, as in this is going to bind to HER2. Hopefully you see where I'm going with this, is why this one's a little bit problematic, but we'll get there. Next, I want to say is that in Dr. Reddy's lecture, he actually misspelled the name of this drug, and it was also misspelled in our Excel sheet that was given on Blackboard. And they actually had it to be Trastuzumab, which would have been more useful, because with Trastuzumab, you can do this to be transformation, as in it's helping with growth. It binds to HER2, which by binding there will inhibit the growth factor of the actual tumors. But because in the real world there is no N, it is Trastuzumab, but it's Trastuzumab. Because in our world there is no N, it is, as in this drug is now trash, because this transformation mnemonic doesn't work anymore. There's like a 50-50 chance it'll be misspelled in the actual exam if they use the slides to write the questions, but let's just take that as a win if they do. So then lastly for this one, it's the idea of you're going to the zoo, as in, I think this is the only drug in our Excel spreadsheet that has this to zoo phrase. So you're going to the zoo on a date with your loving GF, in parentheses, with her. So here the to zoo GF is of course going back to this growth factor here, and then with her, this would relate to her too. So yeah, pick and choose whichever of those you want, or all of them, kind of whittle our way through the usefulness of this monoclonal. So lastly, onto Rituximab. Now, there is a problem here with what First Aid did to remember both of these, because this is a 2 for her 2, and this is also a 2, but this one is for CD20 B cells. And so the natural progression is, okay, well, I can buy that both of these have a 2, so like Rituximab, Trastuzumab, but how do I distinguish which one is just the normal 2 and which one's the 20? Well, we've got you covered. So by looking at Tux, as in this is the only drug in this kind of 50-50 that's going to have something that's very expensive on it. So a Tux, tuxedos are generally very expensive. Therefore, Tux equals bigger in price, as in expensive, therefore bigger number. So that is the way that I would recommend to know that, yeah, you can use the 2 mnemonic for each of these, but to actually differentiate which one's the CD20 versus which one's the HER2, Rituximab, more expensive, it's the larger number. That is the summary of all of the monoclonal antibodies. Now on to our last chunk, the other category. Firstly, with Methotrexate, we're going to be using the sentence, my ex Luke is full of meth mnemonics making a comeback. This time, though, the meth and the X combining to yield the Methotrexate, which is none other than a folate analog, hence the FOL. The FOL stands for folate analog, and one of the problems that patients can have with taking this folate analog is that a lot of their healthy cells are having issues because they're not using real folate. The folate analog is not only being used with the cancer, but also just the normal cells in the body, which leads us to our actual treatment that is then given if there is too much of this folate uptake by normal healthy cells. That is where Luke comes in. Luke, the X, stands for leucovorin, as in that is the treatment that will be given for the methotrexate toxicity. So this next one might be a bit of a doozy. For Vincristine, I would like you to think of none other than Jesus Christ himself. In particular, there's some attributes about Jesus Christ that would be useful to know what Vincristine does. So assuming y'all know what Jesus looks like, I'll put up a picture now of what I'm talking about. I was raised Christian, so I should get a little bit of a pass of using this as a mnemonic and spreading my wisdom here. But first off, we had the idea that Jesus is on the cross, very iconic of an image in Christianity, and the idea of him being on the cross is because this is a drug that is inhibiting microtubules. And as we all know from first term with our cell bio lectures, microtubules are crossed at the centrosome during mitosis. So the cross, think of microtubules as in it is a microtubule inhibitor. Next, when you look at Jesus on the cross, he's looking pretty limp, just up there and all that. Limp is useful as a word because it is very similar to the word lymph, as in this is used to treat lymphomas, among other things. And lastly, on the cross, Jesus has nails in his hands and feet, and this is important for a side effect of Vincristine treatment, which is peripheral neuropathy, as in it would happen in the extremities, and that's where Jesus was nailed to the cross. Amazing. So for our last mnemonic of this video, for Imatinib, the sentence is, the baker is able to make caramel for fussy nibblers. So nibblers is of course referring to Imatinib, the only important NIB drug that we have to know for this term. Baker is able is similar to BCR-ABL, as in there is a fusion of these two at the tyrosine kinase, as in it is a fusion kinase, fussy for fusion kinase, but in particular, the cancer this treats is CML, as in chronic myelogenous leukemia, as in caramel. So CML for caramel, Baker's able for BCR-ABL, fussy for fusion, and nibblers for Imatinib. So here is the summary for the last set of the drugs. So here it is all together. I'll have a timestamp in the description for if you want to get to this slide itself. And yeah, thanks again to Josh and Deborah for helping me out with making these, helping me give back to the class. There is hopefully more mnemonic videos on the way to get us through the drugs we have to know for term 3. Because I don't know about y'all, but I really hate sketchy sometimes, and if there's a dumb sentence I can use instead of a visual mnemonic, I would be very grateful for that. So definitely coming up, I have plans for antiviral video and potentially some little things on microbials and immunomodulators as well. So yeah, thanks for watching. Hope y'all found this helpful, and let's get through term 3.